Scene script. Have you ever wondered what liver cancer may feel like? It's a question many health enthusiasts ponder on. Liver cancer, a menacing disease that silently creeps into the body, is a form of cancer that starts in the cells of your liver. Your liver, a football-sized organ sitting just under your ribcage on the right side of your abdomen, plays a vital role in digesting food, storing energy, and removing toxins. When cancerous cells take hold, they interfere with these crucial processes, leading to a cascade of health issues. One of the biggest challenges with liver cancer is that it often doesn't show symptoms until the later stages. This makes early detection crucial for successful treatment. The good news is that by staying informed about the potential signs and symptoms, we can significantly increase our chances of catching this disease early. In the next few minutes, we will uncover the common signs and symptoms of liver cancer, so stay tuned. Detecting liver cancer early significantly increases the chance of successful treatment. But how can one achieve this? It's all about vigilance and understanding. Recognizing symptoms is key, and seeking medical attention promptly when they appear is crucial. Now you may wonder, what are these symptoms? The truth is, they can vary from person to person. Just like how we all have unique fingerprints, our bodies react differently to diseases. Some may experience a set of symptoms while others may have different signs altogether. This variability doesn't make it any less important to be aware of the common symptoms. Remember, early detection of any disease, not just liver cancer, often leads to better outcomes. It's like catching a small fire before it engulfs an entire building. The sooner you catch it, the better the chances of extinguishing it completely. Understanding the symptoms of liver cancer is the first step towards early detection. So what are these symptoms? Liver cancer manifests in many ways. Let's delve into the most common signs and symptoms. Firstly, a loss of appetite is a common early warning sign. This isn't just skipping a meal here and there. We're talking about a prolonged, unexplained lack of interest in food, which may pair with a sudden distaste for your favorite meals. This condition can result in another common symptom: unexpected weight loss. You may notice your clothes fitting more loosely, even without a change in your diet or exercise routine. Next, let's talk about jaundice. This is a yellow discoloration of the skin and eyes that occurs when your liver isn't processing bilirubin, a yellow-colored waste material, effectively. This symptom is not exclusive to liver cancer, as it can also be a sign of other liver diseases. Nonetheless, it's a clear signal that something isn't quite right with your liver. Moving on, we have pain in the upper abdomen. This is the area on your right side just under the rib cage where your liver resides. The pain may extend to your back or shoulder blades. It's important to note that this isn't your typical stomach ache or muscle pain. It's a persistent discomfort that doesn't go away with over-the-counter pain relievers or rest. Swelling in the abdomen is another common symptom. This can be caused by two factors. Firstly, the tumor itself may cause the liver to enlarge. Secondly, liver cancer can lead to a buildup of fluid in the abdomen, a condition known as ascites. This can cause the abdomen to feel bloated or distended. Other symptoms can include nausea or persistent vomiting, a general sense of feeling unwell, and chronic fatigue. You might also notice a chalky white color to your stool or dark-colored urine. It's important to remember that these symptoms can also be caused by conditions other than liver cancer, such as hepatitis or cirrhosis. However, if these symptoms persist, it's a strong signal that you need to consult a healthcare provider. It's also worth noting that many of these symptoms may not appear until liver cancer is at an advanced stage. This is why regular checkups and screenings are so important, especially if you're at a higher risk for developing this disease. Now you might be wondering, how can I differentiate between typical bodily quirks and these cancer symptoms? It's all about the persistence and severity of these signs. If you've had persistent abdominal pain, unexplained weight loss, or any of the other symptoms we've discussed for a few weeks, it's time to get checked out. Remember, early detection is key to effective treatment. So, if you're experiencing these symptoms, don't brush them off as nothing. It's always better to be safe than sorry when it comes to your health. Before we wrap up, let's quickly touch on the fact that everyone's experience with liver cancer can be different. Some people may show all these symptoms, some might show only a few, and others may show none at all until the cancer is advanced. That's why it's so important to listen to your body and take note of anything that feels off. If you or someone you know is experiencing these symptoms, it is crucial to consult a healthcare provider immediately. It's important to note that liver cancer can progress without noticeable symptoms. However, certain advanced symptoms can occur. When liver cancer advances, it can cause more apparent and severe symptoms. This can include changes in the color of your urine and stools. Imagine this. You've just gone to the restroom and you notice that your stools are white or chalky. This is not something to ignore. The liver produces bile, a yellow-green fluid that gives stools their brown color. If the liver isn't working properly, the stools can become white or chalky. If that's not alarming enough, another symptom can be dark urine. Normally, urine ranges from a light yellow to amber color. But when the liver isn't functioning correctly, bilirubin, a yellow compound that's usually processed by the liver, can build up in the blood and make the urine darker. But what increases the risk of liver cancer? Well, there are several factors at play. Chronic hepatitis, particularly hepatitis B and C, is a leading risk factor. These viral infections can lead to cirrhosis, a scarring of the liver that increases the chance of liver cancer. Heavy alcohol use is another risk factor. Consuming large amounts of alcohol over many years can cause cirrhosis and other liver damage, increasing the risk of liver cancer. And let's not forget about obesity. Excessive body weight can lead to a condition called non-alcoholic fatty liver disease, which can increase the risk of liver cancer. It's important to remember that having one or more of these risk factors does not mean you will definitely get liver cancer. However, they do increase your risk, and being aware of them is the first step to taking preventive measures. So if you are at risk, it's crucial to have regular checkups, maintain a healthy lifestyle, and limit alcohol consumption. These steps can help reduce the risk of developing liver cancer. Knowing the risk factors helps you understand your chances of developing liver cancer, and taking necessary precautions can help in prevention. We've learned a lot today about liver cancer, its signs and symptoms. It's a topic that might seem daunting, but understanding it is a crucial step towards prevention and early detection. We dove into the importance of recognizing symptoms, highlighting how early detection can drastically improve the prognosis. We discussed that liver cancer can often be silent in its early stages, making regular checkups and being aware of your body's changes incredibly important. We also explored the common signs and symptoms of liver cancer, such as unexplained weight loss, loss of appetite, and upper abdominal pain. Remember, these symptoms might not always mean cancer, but they're certainly indicators that something might not be right, and a visit to a healthcare professional is warranted. We went on to discuss advanced symptoms and risk factors, emphasizing that liver cancer doesn't occur in isolation. It's often linked to conditions like chronic hepatitis, cirrhosis, or a family history of the disease. But information without action is like a car without fuel. It's not enough to simply know these signs and symptoms. We need to take action. Regular checkups are essential, especially if you fall into a high-risk category. If you feel something's off, don't ignore it. Reach out to your doctor. And equally important is sharing this knowledge. The power of information is multiplied when it's shared. So, let's use this knowledge to create a ripple effect. Share this video with your friends, family, and social circles. Spread awareness about liver cancer. Let's make sure that more people are equipped with the knowledge to recognize the early signs and act promptly. Remember, knowledge is power. The more we know about diseases like liver cancer, the better we can protect ourselves and our loved ones. Thanks for watching, and stay healthy.